at it in the other way, we have a local effect, which is anus and rectum, organ effect, which is the large intestine, systemic effect, which alters your metabolic response and the nervous response, and the fourth one is kind of, we don't know what we don't know. That's things that Alison has talked about. That's your gut feeling. What I've done for the rest of this presentation, I've done both contraindications and cautions. I'm not going to focus on how I've divided them into contraindications and cautions. There's just not enough time for this. But I have divided them on which is a complete no-no, which is a relative no-no. So here are the contraindications, which is a complete no-no.
Abdominal pain, severe anemia, abdominal aortic aneurysm, cancer in partial remission,
colorectal carcinoma, acute colitis, cystitis, diarrhea acute of unknown origin, diverticulitis, all the itises, active fissures, active fistulae, hemorrhage, GI hemorrhage, hiatal hernia, uncontrolled hypertension, uncontrolled hypotension, IBD, acute, liver cirrhosis, any term of pregnancy, prostatitis, renal insufficiency, severe cardiac disease, abdominal surgery within 8 months, and ulcerative colitis in the acute form. Let's go back to our groups. First group is the circumstances in which the introduction of the nozzle or speculum can aggravate the anus or the rectum. Circumstances in which water can aggravate the existing condition in the large intestine. The circumstances in which hydrotherapy through the anus can alter metabolic and nervous response, threaten homeostasis in the presence of an existing condition that is threatening it already. And the final group of circumstances related to a situation in which the speculum will not damage the anus, the water will not threaten homeostasis, how the treatment will not be beneficial to what I would describe as the bigger picture. We've got the same again here, groups 1, 2, 3, and 4. So we've got local damage the large intestine, upset homeostasis, or hard to put a finger on. Now it's that easy. Local damage is active fissures, active fistulae, and hemorrhoids, which are internal or external and painful. Damage to the organ, colorectal carcinoma, acute colitis, diverticulitis, anything ending in itis, which is in the bowel, don't touch it. Hemorrhage, inflammatory bowel disease, acute, ulcerative colitis, acute. All the things which are spread in the colon and are not healed. If you put water in there, they will be less healed. Threat to homeostasis, very underrated in our profession. If you alter water balance, and if there is something else which is already altering water balance, that can just tip it over. Severe anemia, abdominal aortic aneurysm, acute diarrhea, uncontrolled hypertension, uncontrolled hypotension, liver cirrhosis, renal insufficiency, and severe cardiac disease. And finally, give it a miss because of what we don't know. Abdominal pain, cancer in partial remission. Unless you're working with a doctor who is going to give you the procedure of treating that particular client, don't do it. Cystitis, any term of pregnancy, prostatitis, and surgery abdominal within 8 months.